Next guest, Congressman Brad Wenstrup of Ohio visited the border yesterday. Congressman, very good to have you. What did you see during this visit?
Well, I saw a humanitarian crisis, and I saw a tremendous need for the president and the vice president, Biden and Harris, along with Dr. Fauci, to go down to the border and see what's happening firsthand. And I say Dr. Fauci because we are in the middle of a pandemic, and I think it should be looked at as to what we have created here since the Biden policies got in place. We have a humanitarian crisis, Neil, that was predictable. Matter of fact, Border Patrol said that they planned for this after the election. Once they saw that Joe Biden won, they knew that there was going to be problems and that their jobs were going to change dramatically from what they had become. In other words, they went from being law enforcement to law enforcement and social workers, which they're really not designed to do, but they are doing it as best they possibly can. Their job is to stop crime and criminals, protect America, facilitate legal travel and legal trade. But now they're overwhelmed. The situation's overcrowded. They had 172,000 just in March, and that's that they know of. So the situation is inhumane. You know, they mentioned just briefly Health and Human Services policy. Well, guess what? That policy is not the policy of the cartels. And so you have women and children that are being trafficked, and the cartels and smugglers don't follow the rules, and they are the ones that are benefiting from this. The policies that have been put in place, we learned, are clearly benefiting the cartels because not only are they making money by bringing people across, they're also making money because more of their drugs and weapons and things like that they smuggle are getting across as well because of the diversion. President Biden said, ignore Title 42, we must take children under 7. So guess what? They respond and they start sending children. The Biden administration had put an end to the Migration Protection Program, which held people in Mexico, or if we sent them back, they were processed in Mexico and they could go through their asylum claims. These types of things were working and they were not overwhelming our Border Patrol in the way that we're seeing now. And then you have some on the Mexican side that are saying, and we're not going to let you return families anymore. So we are now seeing an increase in families and an increase in unaccompanied children, as well as the increase in the other categories as well. So when it comes to overcrowding, you have facilities that CDC guidelines said you can hold 250 people. We have 3,500 yesterday, been up to 5,000. We have facilities.
And what do you think, Congressman? What do you think on that to ease those numbers? The Biden administration is apparently seriously considering cash payments to Central Americans, those specifically from Guatemala and El Salvador, to mitigate the flow of those rushing to the border. What do you think of that?
Well, in what way are they going to do that? Where does the cash go? You know, is the government just going to keep it for themselves? What does that money actually do? Who does it serve? The problem is when the policies are such that you can get across, and people, I understand why they want to come to America. I get that. But when the policies are such that the door is open, the cartels take advantage of that. So you can make arrangements with the government, but if you're not controlling what the cartels are doing, I don't know that that's going to do much good.
Got it.
Facilities that should hold 33 children by COVID standards, and there's 393 yesterday, 413 in another, 600 in another. Yet at the same time, I want to give them credit where it's due. They are screening. You know, we went down as doctors and from the Intelligence Committee. They don't test COVID of all these kids unless there's symptoms, because otherwise they are tested later when they're finally out of their care. We're seeing chickenpox, lice is huge, scabies, kids with the flu, fevers of unknown origin, meningitis. There is emergency medical technicians there. They do take people to the hospital. And at the same time, they're getting food, clothes, showers every day. But they're only supposed to hold them for 72 hours, and then they're supposed to be turned over to HHS. HHS was entirely unprepared for what came our way. They built a brand new facility that we were the first to go into, and it's a nice facility. It should take care of a lot of kids, but not as many as the number of kids that are coming in. The manpower is down for the Border Patrol. Many people are retiring. They're not being able to do the job that they were assigned to do.
All right, Congressman, thank you for the update. And just to your point, 170,000 migrants picked up from the border. That's a 70% increase from just the prior month.